The last few weeks, we've seen cases of monkeypox pop up in some American cities. And tonight, we can tell you a possible case of the virus has now landed in Oregon.
Yeah, one man has a probable case after traveling, but the Oregon Health Authority wants you to know tonight that this is no time to panic. We're still waiting for CDC confirmation, but we do know monkeypox does not spread as fast as viruses like COVID-19. Fox 12's Drew Marine joins us now live with what you need to know. Drew?
Yeah, the OHA says it would take prolonged skin-to-skin contact to catch it, or you'd need to be within 6 feet of someone for 3 hours to be infected otherwise, which is rare. The first potential case of the human version of monkeypox, also known as hMPXV, is now in Oregon.
The person had traveled to an area, and in this case, another country, where this virus is circulating.
The symptoms are similar to a cold or flu. People might get a fever, have swollen lymph nodes or a cough, but Legacy's chief medical officer, Lori Farrell, says there's one main sign to look out for.
Rash is the big differentiating feature from colds or flus. So pox-like, which is a blistering type rash, will be the main thing. Is, anyone who comes in with those cold or flu-like symptoms but has the rash or calls in with those symptoms, that is when we'd be thinking about monkeypox. Also, if they have travel exposure.
Luckily, it's easy to avoid, so Dr. Richard Lehman with the Oregon Health Authority says there's no need to panic.
This is not an easy virus to catch. Prolonged skin-to-skin contact, often during sexual relations, and less commonly, it could be that this could be spread by somebody coughing or sneezing, but you gotta be within 6 feet of somebody for like 3 hours.
But if someone does get it, it'll very likely be a mild case.
While you have open sores is when you want to stay isolated and away from people. That's going to vary person to person how long it takes. So unlike, again, COVID, it's not 5 days or 10 days. It's until your lesions are completely are healed. For most cases, this is not going to be treated. Most cases will be mild and people will get over it like a cold or a flu.
While there is a vaccine for hMPXV, Lehman says there's no need to go get one, especially because there hasn't been any evidence of transmission in Oregon. Live in Northeast Portland, Drew Marine, Fox 12 Oregon.